What if I told you that a country is on the brink of eradicating a disease that's been silently wrecking livers for decades? Let me paint a picture. Imagine a virus that hides in plain sight, sneaks into your body through a needle prick or a blood transfusion, and then sits there for years without you even knowing. That's hepatitis C, and guess what? England might just be about to pull off one of the most impressive public health victories of our time. But here's the kicker, this isn't just about medicine. It's about how societies choose to confront invisible threats, and what it reveals about our priorities as a collective. Personally, I think this story is way more than a healthcare win. It's a masterclass in how to turn a silent killer into a solvable problem, and it's got lessons for everything from mental health to climate change. Let's unpack this. You know how sometimes you hear about countries making bold health goals and then nothing happens. England's approach feels different. They are not just throwing money at the problem, they are rethinking how we detect, treat, and even talk about diseases. Take this, they've managed to treat 80% of known cases already. That's not just a number. That's a seismic shift. Think about it. This virus has been around for centuries, infecting millions, and now, in a single generation, they are nipping it in the bud. What makes this really interesting is the method. Instead of waiting for people to come forward with symptoms, they've gone proactive. Free at-home tests, blood screenings in A&ES, even pushing for GP registration checks. It's like they've flipped the script on traditional public health models. In my opinion, this is the future of disease prevention, making testing so accessible it's almost frictionless. But here's where it gets tricky. Only 84.6% of infected people are diagnosed. That 15% gap. That's the shadowy part of the problem. What many people don't realize is that these undiagnosed cases are ticking time bombs. They are the ones who could spread the virus unknowingly, or develop cirrhosis or liver cancer later. It's a reminder that even the best systems have blind spots. Now, let's talk about the treatment itself. These antiviral pills that cure over 95% of cases in 8 to 12 weeks. That's not just a medical miracle, it's a socio-economic revolution. Imagine a world where a simple medication can undo decades of damage. But here's the catch, this isn't just about the drug. It's about trust. People like Paul Eatwell, who got diagnosed after a routine blood test, had to grapple with disbelief. Are you sure? Surely there's been some mistake. That reaction isn't just personal, it's cultural. We are conditioned to think of illness as something that happens to people who look sick. But hepatitis C thrives in the shadows, and that's why England's strategy of mass screening is so radical. It's not just finding the sick, it's redefining what sick even means. One thing that immediately stands out to me is how this campaign targets specific demographics, like people born in Eastern Europe. Why? Because of historical medical practices before 1991. That's not just data. It's a haunting reminder of how systemic failures in one era can ripple through generations. If you take a step back and think about it, this is a blueprint for addressing legacy health issues. It's not just about treating the present, it's about reckoning with the past. But here's the deeper question, what happens when we actually succeed? Eliminating hepatitis C isn't just about saving lives, it's about reimagining public health as a proactive, almost preventative art. This raises a fascinating paradox. The more we solve these problems, the more we have to ask ourselves, what's next? Because if England can do this, why can't we do it for other diseases? Or better yet, why can't we apply this same logic to issues that aren't medical at all? A detail I find fascinating is how this campaign doesn't just focus on the virus, it focuses on the people. Free, confidential tests. No GPS required. That's not just accessibility, that's empowerment. It's saying, we are not here to judge you. We are here to help. And that, to me, is the real breakthrough. What this really suggests is that public health isn't just about science, it's about human connection. It's about creating systems that don't just treat symptoms, but build trust. So the next time you hear about a health crisis, ask yourself, are we just reacting, or are we redefining the game? Because if England's story is any indication, the future of healthcare might be less about fighting diseases, and more about outsmarting them before they even have a chance to hide.